As a bariatric surgeon at Roux-en-Y, I do a preoperative assessment of our patients, perform the surgery, as well as do postoperative care. I participate in informational sessions as well as support groups. We're very active as a team with regards to our patients. Generally, with the gastric sleeve or the Roux-en-Y gastric bypass, patients will lose 60 to 80% of their excess weight. Excess weight means how much weight you're over your ideal body weight. Weight loss begins to slow after the first year. We like to tell our patients the maximal effects of bariatric surgery is up to 18 months. So within the 18 months after surgery is when you're ever going to lose the most weight ever in your life. Prior to bariatric surgery, patients have to undergo a nutritional assessment, also a psychological assessment, and we want them to learn how to live a healthy lifestyle. We tell our patients that bariatric surgery should be just a booster button, turbo button for them to lose weight. Once the patient gets healthy eating habits, healthy exercise habits into their lifestyle without thinking about it, then this should be able to maintain post-operatively and helps maintain the weight once the weight slows after the effects of surgery has finished. We like to explain to our patients that, again, surgery is a tool. To undergo bariatric surgery, you have to be all in, mind, body, and spirit. Bariatric surgery will affect the way your body metabolizes, but we cannot fix how your relationship with food or how you do your daily exercise. That is up to the patient. Therefore, you have to be ready to undergo bariatric surgery and be willing to make that commitment before you want to undergo our program or any bariatric program. Having bariatric surgery is a commitment to a healthy lifestyle with diet and exercise. We want our patients to be ready for that change. When our patients undergo surgery and they're still not all in, they struggle, and many people struggle through the change. But once they see that they're losing weight and their hypertension goes away and their diabetes is cured and they slim down many sizes, their lives have changed. They mentally are happier because they see a different life and they see that they can do all these other things that they weren't able to do before. Typically, our bariatric patients have been obese all their life. So to be smaller and to be able to be more active, it is a big deal. And also, it affects families also. When patients are able to do things with their kids, go on trips, go on the plane without struggling so much, then bariatric surgery can be worth the struggle to get there. At Roux-en-Y, urge our patients to go to support group, and our support groups are led by our patients. It's a self-motivating group that helps each other, and it keeps you honest, it keeps you motivated to continue your healthy lifestyle because these people are around you, know what bariatric surgery has done for them. The sleeve gastrectomy and the Roux-en-Y gastric bypass are not just weight loss operations, they are metabolic operations. By altering the anatomy of the body, it changes the hormones and chemical reactions that happen in your body. It changes the way we digest food. Therefore, it's not just a restrictive condition, like you just don't eat less. It makes your body think differently and metabolize differently. And that's why I like to tell our patients it's a booster button. Not only are you eating better and exercising more, your body is metabolizing different to help you with overall weight loss. Bariatric surgery may be one of the hardest things someone's ever going to do, and patients often say this. It is changing their entire life. It is changing how they perceive food and how they exercise. It asks a lot of a person. So it really takes a big commitment, mind, body, and spirit, for a patient to undergo bariatric surgery. It's a one-shot deal. It's a lifelong commitment. And its outcomes are really good if you maintain the weight loss postoperatively. I watch my patients struggle preoperatively to lose weight and postoperatively to understand how to deal with the changes and how to live their lives now. But at the end of the day, with the weight loss, their diabetes is cured, their blood pressure is cured, they can move, they're just on vitamins. So the struggle is worth it, because at the end, you live longer, happier lives. When a patient is bigger, the heart has to pump harder to get the circulation throughout the entire body. So this makes your heart work harder. And I also like to view obesity as an inflammatory state. The fat in your abdomen is called visceral fat, and this fat secretes a lot of hormones that cause inflammation. So generally, patients with obesity are likely to have worse asthma, worse rashes, get sicker faster, because your body is inflamed all the time. At Polymomy, our outcomes for bariatric surgery are comparable to those in the nation. With bariatric surgery, high blood pressure is cured 80+% of the time, and so is diabetes. Diabetes requirements go down. Other conditions include sleep apnea. Sleep apnea is better because people have less pressure on their chest. Reflux is better because there's less pressure in the abdomen. Polycystic ovary disease is also cured with the metabolic changes in surgery. There's less pressure on the joints and on the bladder, and that can cure stress incontinence and joint problems. So overall, our patients feel better because their body doesn't have to work so hard to fight these other medical conditions.